was concerned about my son's health. He had blood coming from his nose and his face was swollen. And he said, "Mama, I'm falling." I said, "What happened?" He said, "I don't know, I just passed out." And I didn't know what to do because I didn't have any insurance or nowhere going anywhere, so I was scared. I was really frightened because, you know, it was like, how can I take him to the doctor? Everything costs. I didn't have money to do all that, and I didn't know what to do. And that's when I brought my son here.
At Legacy, about 82% of our clients have no health insurance whatsoever. About 74% of our clients have annual incomes under $20,000 a year.
Legacy has really evolved in this last 2 years to meet the needs that are out in our city as a whole, not just one segment of our community, but to really meet the healthcare needs of our city.
I'm very excited to be the medical director of Legacy because this is an agency that is so dedicated in providing healthcare, quality healthcare to such a diverse population. From a 2-month-old baby to a 100-year-old woman, from well women exams to well man exams. So we're encouraging that and we're growing to be able to provide those services.
We've really made tremendous steps this year in creating our healthcare village. We've expanded our services to serve cradle to grave. Everyone can come to Legacy. We've expanded ophthalmology, we've expanded psychiatry, we've expanded our primary care services and our primary care hours. And as a result, the community's responded in a very positive way by accessing the services. And we're just thrilled. In the future, the village is only going to get bigger. We've always known our clients really needed easier access to pharmacy services. Many of our clients take multiple medications. Many of them have difficulty accessing transportation. So we approached Walgreens, and they've really become a true partner with us. The other thing is anybody in the community can come access their pharmacy services at the Walgreens in our building. You don't have to be our client. That really helps us. Always had vision care, at least for 10 years we've had it, but the new thing is we're now full-time. I mean, we've never been able to do that before, and we've finally been able to add Dr. Sawyer full-time.
Our goal as part of the Frost Eye Clinic is to expand the services of the eye clinic as Legacy Community Healthcare Services expands their services. We're trying to keep up with the medical community and stay state-of-the-art in spite of the fact that we're working with predominantly indigent and uninsured or underinsured people. But they deserve the best medical care, and we're here to help them achieve that state-of-the-art care that they really do deserve. One of the areas I'm excited about getting into in the Lions Clinic is pediatric eye care. Kids can't tell you when they can't see. And so our idea of going in and being able to screen these children, make sure they have their vision, and keep their vision. But I'm really excited about getting over there and trying to take care of some of those little kids in the Lions Clinic, because that's a real passion of mine.
The resale shop has been a dream of mine for about 5 years, and the funds from the resale shop go to support our mission. We wanted it to be unique.
I had a vision to come in and refit and redecorate and retool the resale center and make it more like a retail store. Presently, I'm involving designers and architects, so when they are refurnishing a home, many times the things that the client is getting rid of are perfectly new, perfectly wonderful things. Having these better products, having a more inviting store with a good staff of people to sell these products, we will raise more money for health services. So I realized I could get the donations made.
And I had the resources to bring in students, and I asked students to come volunteer and help repaint this resale shop. 100% of the people who signed up to come paint came. College students do want to give back to the community, and it creates in them, like it did in me, a sense of pride to help out other people who are less fortunate and who do not have the resources necessary to access adequate health care.
There's a tremendous need in our community for mental health services, and Legacy has answered that call. We were able to bring on a psychiatrist full-time, and he's unique in that he's very competent in seeing children and diagnosing emotional difficulties and mental illness in children, and he's very proficient in seeing adults. We were approached by the city to bid on establishing a clinic, a primary care clinic in the Fifth Ward neighborhood. We're really providing very comprehensive care for the neighborhood. I think some of my favorite people are some of the elderly people that have been coming in who really haven't accessed care because they haven't had anywhere to go. They know the neighborhood so that they don't have to get on the freeway, they don't have to go into the big medical center, and that can be very intimidating for somebody, especially if there's somebody who's elderly and really doesn't venture out as much as they used to when they were younger. So it's much more relaxed and easier to get care, and that's one of the barriers we wanted to make sure that we addressed was the transportation barrier and the feeling comfortable where you are.
Geriatric medicine is becoming not only more challenging, but a very important specialty because the population over 65 in the U.S. continues to rise. And those are the patients that are going to become very, very challenging because of their multiple medical and social problems. And that's where we will need agencies like Legacy to come through for them.
Everyone involved with Legacy is so proud of the work that's being done to help improve the quality of life of the people around us. It makes a huge impact on our community.
What we do really does make a difference in the lives of our clients.
I always worried about my kids a lot. And I always wonder how I was going to do things with them when I didn't have the things. And, you know, they just made me feel like a person, not by my circumstance. They just made me feel comfortable and made me not worry as much as I was worrying. And I was just feeling bad as a parent that I didn't have the resource my kids need.
We at Legacy provide extraordinary health care for extraordinary people by extraordinary people.
Legacy has provided for me, has given me an element of stability that doesn't exist in other aspects of my life right now. It's one problem, at least for the moment, I know I don't have to worry as much about.
People at Legacy, they don't know me, but they took me in. And what did they do? Care for me. They check on me. I can say that they're the closest thing I have now.
If it were not for the programs that Legacy was providing at the Body Positive Wellness Center, I would probably not be here.
And they just treat you with love, and you can't buy that anywhere.